We launched over 100,000 community health promoters. Why can't we start there? Why can't we inform community health promoters how to be able to ensure those on the ground or grassroots level can be able even to identify such instances of probably a lump? Let me tell you why. When you first discover cancer, the reason why it's called non-communicable, it's not painful. The lump doesn't start as a painful mass. It starts as something so small that you just think, yeah, you know?
Yeah.
So for you to be told, you know, it's just nothing. It's just nothing. It's a discomfort. It's just nothing. But then, depending on the type of cancer that it is and how it progresses, then now it becomes something tragic. Why do I say that? I spoke to 2 oncologists prior to this. One of them when I was doing this story. So one, I had an opportunity to speak with him, he's called Dr. Marek. He's an oncologist at the Aga Khan Hospital. And then the other one is Dr. Moki, the one who I did speak to, an oncoplastic breast surgeon. They noted something that's now changing in this demographic. Cancer was normally a prevalent disease for 40-year-olds and above. But now in not only Kenya, by the way, in the East African region, we are seeing a lot of cancer cases among young ladies, even below the age of 30.
Yeah.
And by the time these cases are being discovered, you go to now, we have roughly 58 oncologists in the country. By the time you go see that professional, they tell you, hey, my dear, I'm sorry, lakini, hapa, you're at this stage, you know, because you missed the whole diagnosis throughout. And then the other thing that they did point out was this particular cancer now that's being detected among the younger generation or the younger demographic is proving to be aggressive, extremely aggressive. You know, so I do understand that, yes, genetics play a role, lifestyle plays a role, but most importantly, these small conversations that we have, self-test, I feel like it's time, even if we should have brought an oncologist on set to even just show us, you know, this is how you self-test, you just how you can test yourself, and so that, because there are those lumps, of course, during that come before a woman's period, harmless, or during, probably towards the end. An oncologist probably will talk best about that. And then there are those ones now that would be very predominant and would now end up being cancerous. Not every lump detected, by the way, is cancerous. That's one thing that also we need to make clear.